don't get it. I simply do not get it. It is literally the least you can do. And if anybody wants to build up an argument about doing the least they can do, I wouldn't trust them with a driver's license. I mean, when you drive a car, you got to obey speed limits. You got to use your turn signal. You got to avoid hitting pedestrians. If you can't do those three things, then I get it. You shouldn't be driving a car. If you can't wear a mask and wash your hands and social distance, I don't understand. I got no respect for you, man.
So I would yield back to the gentlewoman and ask if she has come across any evidence that has somehow eluded the Secretary of Health and Human Services, the World Health Organization, and countries and our counterparts in Europe.
I'll make the point I made before. Why do we want to really politicize an issue of public health and public safety?
To be very clear, I just asked the gentlewoman to provide us with some evidence in support of her position after she herself claimed that her position was evidence-based and she could not do so. Just like the Secretary of Health and Human Services could provide no evidence for a policy that has been rejected broadly across the world. Mr. Speaker, throughout the COVID-19 era, the United States was an outlier in many ways, but perhaps most of all when it came to the treatment of young children. And a very clear example of that is the policy of forcing toddlers to wear masks. This is from an article from NPR in January of 2022. It says the United States is an outlier in recommending masks from the age of 2 years old. The World Health Organization does not recommend masks for children under age 5. Well, the European equivalent of the CDC doesn't recommend them for children under age 12. And when it came to the Head Start program, not only was it recommended, but it was mandated that children as young as 2 years old, over 1 million kids in Head Start, had to wear masks up until January of 2023. Now, this flew in the face of not only international norms, but of all scientific evidence. Study after study has shown no public health benefit to forcing young children to wear masks. For example, a 2022 study by Dr. Amberis Chandra and Dr. Tracy Beth Hogue was titled, "Lack of Correlation Between School Mask Mandates and Pediatric COVID-19 Cases." At the same time, the evidence continues to pile up as to the harms done to young children when it comes to the disruption of holistic processing, of face perception, of social skills, of emotional development, not to mention the misery that they cause young children having to wear masks for hours on end each day. But perhaps the need for this amendment was most clearly demonstrated in some truly unbelievable testimony by Health and Human Services Secretary Javier Becerra earlier this year. I asked Secretary Becerra whether the policy of forcing 2-year-olds to wear masks saved lives, and he responded by saying, "Who did the forcing?" The answer, of course, was him, and when I pointed this out, he said, and this is a quote, "We never forced anyone to do anything." That's what he said. We never forced anyone to do anything, when in fact the relevant regulation stated that there was a requirement for universal masking for all individuals ages 2 and older. So I asked him, can you point to any public health benefit to forcing young children to wear masks? He could provide none. I asked, do you, as the Secretary of Health and Human Services, can you point to any evidence that there was a public health benefit to forcing young children to wear masks? And the flailing secretary, unable to come up with anything, simply said that fewer people are dying in 2023 of COVID than were dying in 2020. What a farce, Mr. Speaker. Think about the parents who had to send their 2-, 3-, 4-year-old kids to school every day under this policy, and now here the Secretary of Health and Human Services doesn't offer an apology, even though he can come up with not a single public health benefit to the policy that was enforced on these families. So for that, I think that we need to make sure with this amendment that this never happens again. This amendment will assure that the Health and Human Services does not dedicate a single dollar to enforcing mask mandates for Head Start. I reserve.
The gentleman from California reserves the balance of his time. For what purpose does the gentlelady from Connecticut seek recognition?
Mr. Chair, I claim the time in opposition.
The gentlelady is recognized for 5 minutes.
I rise in opposition to this amendment. This amendment prohibits the use of funds by HHS or any grantee to implement a mask mandate at Head Start programs. First, I think we need to be clear about the facts. There is currently no federal mask requirement in place. There is no federal mask requirement in place. This amendment would leave federal government ill-equipped to implement evidence-based policies that protect the health and safety of the public if we face another public health emergency, such as a dangerous new COVID-19 variant. Preventing diseases reduces healthcare costs, such as hospitalization and pharmaceuticals. Masking is a critical public health tool. New variants are an expected part of the evolution of viruses and can be more aggressive, transmittable, or cause more severe disease than the original strain. Face masks can protect the wearer and those around them by preventing transmission. Although many people would like to act as if COVID is over, it is not. Over the past 3 years, there were more than 1 million deaths due to COVID in the United States, some of whom the people in this room knew and loved. We also know that some people infected with the virus that causes COVID-19 can suffer long-term effects from their infection, meaning they can experience health problems that can last for years. Our nation's public health officials need to have options to protect our communities as we continue to live with COVID and respond to other public health emergencies in the future. Why would we politicize something that could help our fellow Americans stay healthy? The sweeping amendment is unnecessary. It puts us all at risk. I think it sets a dangerous precedent for Congress to overrule a scientific process. Follow the science. That's what we need to be doing, and not following the politics, the religious beliefs, the philosophies, the ideology of Republican members of Congress. I urge my colleagues to oppose the amendment, and I reserve the balance of my time.
The gentlelady from Connecticut reserves the balance of her time. The gentleman from California is recognized.
Well, the gentlewoman from Connecticut referred to evidence-based policies, and yet the Secretary of the U.S. Department of Health and Human Services could not cite a single piece of evidence in support of this policy. And not only that, this policy has been rejected by the World Health Organization, and it's been rejected by the European equivalent of the CDC. So I would yield back to the gentlewoman and ask if she has come across any evidence that has somehow eluded the Secretary of Health and Human Services, the World Health Organization, and countries and our counterparts in Europe. I reserve.
The gentleman from California reserves his time. The gentlelady from Connecticut is recognized.
I continue to oppose this amendment. I make the point I made before. Why do we want to really politicize an issue of public health and public safety? We can come together around these issues. It's not a matter of gotcha or so. Yeah, you know, we all experienced a very traumatic period in our lives with COVID-19. And yes, there were, masks. We're trying to find our way forward to protect people in this country. That is essentially what it's all about. You can have a disagreement, but why would we prohibit the use of funds by HHS or any grantee to implement a mask mandate at Head Start programs when there is no federal mask requirement in place? I oppose the amendment and I yield back.
The gentlelady from Connecticut yields back the balance of her time. The gentleman from California is recognized.
To be very clear, I just asked the gentlewoman to provide us with some evidence in support of her position after she herself claimed that her position was evidence-based, and she could not do so. Just like the Secretary of Health and Human Services could provide no evidence for a policy that has been rejected broadly across the world. So I would strongly urge passage of this amendment. It is past time to restore some sanity in this country and to make sure that the sort of harmful, unevidence-based policies that so many Americans have to live with never again return in this country. Thank you, and I yield the remainder of my time.